to Menopause Morph, your time to change. We're here to help you thrive through your menopause, bringing you experts in many fields to help you from perimenopause to menopause and beyond to become the strong, vibrant woman nature intended you to be. Hosted by Pauline McCarthy of the Pearls of Pauline, pearls of wisdom, compassion, and joy.
Hello, welcome to this week's Menopause Morph. Today our lovely guest is Dr. Andrea Pennington. Andrea is an integrative physician, acupuncturist, meditation teacher and sex educator, specialising in longevity, self-love and resilience. She is the author of The Orgasm Prescription for Women, The Pennington Plan, and co-author of the international bestseller Heart to Heart, The Path to Wellness, as well as co-author of Resilience Through Yoga and Meditation. As shared in her inspiring TEDx talk entitled Become Who You Really Are, she explains that recovering from a long history of depression and anxiety came when she learned to love and express her authentic self. Her TEDx on mindfulness and meditation elaborates on how to create a self-resistant personality with the top 10 traits of highly resilient people. So welcome, Dr. Andrea.
It's my pleasure to be here. Thank you for having me, Pauline.
Okay. We met in Iceland a few years ago now, wasn't it? And so you know the land of fire and ice, and you survived.
I survived, and I think I've been to Iceland now 5 times in the
wonderful.
last year and a half. But yes, it was wonderful to connect then, and it's wonderful to connect again.
So I'm wondering, why did you write a book about orgasms? Did you come to Iceland and go, oh, this is the orgasmic country of the world? No, tell us the truth. Why did you write the book about orgasms?
Well, Iceland does play a very prominent role in this book's creation. I wrote the book, Pauline, because many years ago, I was working in America as an anti-aging doctor. And many of my patients are, 40, 50 and up. And our whole goal is really preventive medicine, and helping you live a good quality of life. It's not like just, we want you to live long. We want you to live longer, better.
Exactly.
And so, of course, part of my training and part of my work with my clients is about helping them have a healthy sex life into their 60s, 70s, and 80s. So it became something that I specialized in with my patients. But I was on a television show in America called The Dr. Oz Show. And he had me there talking about diabetes and heart disease. And I mentioned that for women over 40, if they have a low libido, it could be tied to their diabetes or heart disease. And I told Dr. Oz that I recommend that women have at least 3 orgasms a week. And the audience went crazy. And then I started getting all these emails from people who said they didn't have any problem with diabetes or heart disease, but they weren't having 3 orgasms a week. And suddenly I'm, being forced to do sex education for the masses instead of just my patients. And what I noticed over the last few years is there are women around the world in many cultures who are suffering, and they're suffering in their intimate relationships and their personal relationships. And that affects our quality of life. And I'm touched by the suffering of others. I mean, I think many physicians are. We go into medicine to help. So when you see women who are giving up a very vital part of their life as a sensual being, that bothered me. And being in Iceland with the beautiful Runa Magnus, who
Yes.
we were talking about, my anti-aging protocols, and we started talking about sex one day. And the conversation just stayed on sex.
Why not?
Exactly. And the whole group just said, why don't we focus on that? And I said, I've had this idea of writing a book called The Orgasm Prescription. So I started talking about it, and everyone said, that's what you should be doing. And it was really that sort of nudge that said, you know what? I've had this book inside me for now over 8 years. It's time to get it out.
Yes.
So that's what led me to write it, is to bring this information about how we as women can tap into our sensuality, no matter where we are in our stage of life, so that we can enjoy our bodies and our intimate relationships. And especially as we hit menopause, especially when you don't have to worry about babies, you should be,
exactly.
you should be enjoying it.
You know, so you were saying that all these women were writing to you and saying they weren't having 3 orgasms a week. So what do you think caused that? You know,
well, there are a number of problems. I think it's different for women in menopause. I think one of the main things is mental blocks. So many women, especially when we're young and we're just in a new relationship, or we have these problems where we stay in our head, where we're worried about how we look and how we sound and are we pleasing him or not? And all of those, blocks that we have about being our true self, they come out in the bedroom. But as a woman gets into her 40s and beyond and her 50s, then we started to see that as the hormone levels dropped, it's, some women, not all, like a lot of doctors would say, oh, it's normal, but it's not normal for every woman to have a drop in her sexual desire just because she's over 45 or 50. Yeah. But what we saw was if they had vaginal dryness, if they were in a relationship that was nice and intimate, but not exciting, then their libido wasn't there either. And so we started really kind of playing with these ideas of how can I turn my body on again and feel that sort of passion and love again. And I tell you, working with women who are nearing menopause or in menopause is so much fun because you can turn it back on.
Yes. That's what I'm always saying to my listeners. And one of the things you talked about was vaginal dryness. And this is like, I did a video, it must have been about 5 or 6 years ago. And it was about the five tips for overcoming menopausal symptoms, And when I talked about vaginal dryness, I didn't have that experience, then, And so I could talk about lubricants and things, but until you actually experience it yourself, it's like, what? It's like some kind of creature has crawled up inside you and is nibbling you from the inside. And even after intercourse, it's painful afterwards, because when it first started, I was like, what the hell's going on here? And, my husband was enjoying himself so much, I didn't want to say, like, back off, buddy, and I just suffered in silence, which was a very, very, very big mistake to make.
Yeah.
Because I couldn't walk properly for the rest of the day, And so is there any particular lubricants that you would recommend? I mean, in different countries, they have different things, but you haven't come to that stage of your life yet, but what would you recommend for your patients?
Well, there are a couple things to think about. So first and foremost, if the vaginal dryness is because the estrogen and the testosterone are dropping, depending on the woman, depending on if you want to go the hormone route, you can go to your doctor and get hormonal creams or suppositories. So using, a testosterone cream or an intravaginal suppository that has estrogen, that's going to help the cells in the vagina continue to produce the moisture and even that elasticity that we need in our muscles. Mm-hmm. Now, many women come to me because they don't want to be on hormones. Yes. And that's when you can look at all of the over-the-counter recommendations, so any of the sort of water-based lubricants, if you want, or the silicone-based ones people are starting to like even more because they can be used with certain sex toys. And I find a lot of people are enjoying coconut oil. Okay. And I think the reason that coconut oil works is because it's very natural. It doesn't cause many of the allergies or irritation that some people can have when they're using some artificial stuff. And it smells good. It tastes good. Some women have gone to, I don't know what it's like in Iceland, but some women can go to their pharmacist and have like DHEA, which is, dihydroandrostenone. Anyway, it's basically the precursor for all of the hormones that we need, like estrogen and testosterone. Mm-hmm. So DHEA can actually be mixed into a little suppository and inserted into the vagina. Now, why is that important? Using it just locally inside the vagina is good for women who are afraid of being on hormones systemically that would cause, a fear of breast cancer or uterine cancer. Mm-hmm. And just using the DHEA one doctor calls it, a vaginal rejuvenation, because it's going to help those cells create the moisture and the plumpness and that elasticity of the muscles. Mm-hmm. So there are a number of recommendations out there depending on if you want hormones or not hormones. And I think that focusing on bringing the moisture in and retaining the moisture is a big thing. So there's the lubricant thing that we just talked about. And the second element is just retaining moisture. So just as if you were out in the sun and your skin gets dry and you put on, some sort of a moisturizer when you get out of the shower, just to keep your skin moist, you can do the same thing for the vagina. So there's a product, I don't know, it's here in Europe, it's in America, called Replens, that is literally just like a moisturizer. It causes the cells to hold on to water. And as the cells hold on to that water, it's just like when you put, lotion on your skin. It feels softer. It's more elastic. Some women will notice that the dead, dry cells will flush out. And it's a product that you use every 3 days. You reinsert this little squish every 3 days. Mm-hmm. So those are the two sides that you want to look at for vaginal dryness. It's the lubricant for just enjoyment and pleasure, as well as just rehydrating those tissues.
The problem I have, right, I use something, I can't remember the name of it, and I put a little drop on my finger, or get my husband to put a little drop on his finger and insert it. But the finger is not as long as the other part of the man's body. And so sometimes when we're getting really personal here. So ladies, if this is too much for you, like go and have a cup of tea and come back later. You hear things, it's not the small details, and it's the small details that really are really important. So my problem is, like, I can't get the lubricant in far enough. The other day I was thinking, maybe I should invent, like when you put a tampon and then you squeeze it in, or a syringe. And I'm thinking maybe I should get a syringe, but the syringe would be hard. And I think maybe I have to invent something that will put this lubricant in far enough. But then I thought, well, maybe there's something like that already on the market. So have you heard of anything like that?
Yeah, well, Replens is like that. Now, it's not a lubricant to enjoy with intercourse or with a sex toy, but it is in a syringe format. So all of the product these are eye drops, but all of the products is in like a tube, an end tube, and then it's just a straight plastic delivery system. And so you would insert that all the way up right around the cervix and squeeze the product in, and it stays in. And again, that's to rehydrate the vaginal wall. So it's not a lubricant. I haven't seen, but I haven't really looked. I haven't seen a lubricant that you inject in.
So I'm wondering, that Replens thing, could you fill it with, when it's empty, could you fill it up with a lubricant? Is there a screw top to put more stuff in it and then put it in?
No, it's not a screw top, but I suppose you could use it like an eyedropper maybe. Once it's empty and you clean it, it would be tough to clean. I think it's not necessarily the delivery system, but maybe just an eyedropper,
Okay, well, then we have to get some kind of mechanical person to design something. Yeah. So there's an opportunity there to start a business. Make a vaginal insertion, what do we call it? Lubricant inserter that's fun. And actually, I had this idea, right, to make a vibrator that had the squishy stuff so you could do all the things at the one time.
All right. One size fits, multi-use.
Like, why not? It's that shape, it slides in, it delivers what it has to deliver, and then you're getting all worked up. So by the time you've done all that, then your partner's the cherry on the cake, isn't it?
Yeah. Hilarious.
Okay, so let's get back to this interview. You gave me some questions, and I think we've gone over it in an abstract way. The question was, as we reach menopause, what options do we have other than hormones to deal with symptoms like hot flashes, vaginal dryness, and insomnia? So we've gone over the vaginal dryness bit. So what about hot flashes and insomnia?
Yeah, my work in Chinese medicine and acupuncture really gave me a nice exposure to some of the Chinese herbs. And many people have seen them because you can even just buy them in a regular pharmacy. There's like a blend. I think black cohosh is the most well-known herbal remedy for menopausal symptoms, and it doesn't have any hormone activity. So for a woman who was worried about breast cancer or uterine cancer, and it actually works on the brain and the nervous system to kind of calm down those hot flashes. But there are other things like red clover, chased berry, hops, Asian ginseng, North American ginseng, dong quai, and licorice, which are known, for their medicinal properties. So those are other options. I find that if you have an acupuncturist or someone who practices traditional Chinese medicine, it's worth it to go and have a consultation, because Chinese medicine is very elegant. It's all about finding what works for you and your energy system. Mm-hmm. And so you can find these combination of herbs that will take care of those symptoms. But I think the easiest one, and the one that I actually love to teach, is mindfulness meditation.
Okay. Mm-hmm.
And it's, believe it or not, what is really cool is that there have been clinical studies that have shown that when you train someone in mindfulness meditation, they can reduce their hot flashes. So just as we've seen some people who use mindfulness meditation to get past their anger or addiction or aggression, you can also use it to bring down the stress response and bring down those hot flashes. And I actually call it a hot flash eraser, because if you learn to just sit and be mindful and present. And so when we talk about mindfulness is just paying attention in the present moment without judgment. So if you think about it,
yeah.
The last time you had a hot flash, or the last time you were laying there up all night, what's going through your mind? Normally there's a lot of judgment, right? We're like, oh, I can't believe this. I'm not getting sleep again. Or, oh my God, when is this going to be over? There's all this negative judgment that we go through. Whereas mindfulness is about allowing that energy to come up, recognizing it, naming it, giving it permission to exist. And what the studies show is that the more you can let it rise, the faster it will leave. And so when women learn to just become mindful, non-judgmental, non-irritated and reactive, it can come up and then they can just watch it leave. And it sounds like voodoo. It sounds like that possibly work. Yeah. But it does, because you're working on the neurologic system. Mm-hmm. Hot flashes are a neurological phenomenon that happens when our estrogen is out of whack.
Yeah. It's like a lady that's going to be on the episode after your episode. She was teaching me about EFT, this tapping.
Yeah, tapping, yeah.
And I thought, this is a load of rubbish, but it actually had a great effect. And she helped me a little bit with hot flashes, but I had a terrible pain hip problem that I've had for many years. And I was gobsmacked. It was like how much less. It was like, what? Yeah. I think
it's the same principle. Mm-hmm. When you're doing that tapping, the EFT or TFT, thought field therapy, you are changing the neurologic firing in the brain and the nervous system. Mm-hmm. And that's how it takes away pain. Mm-hmm. And it's the same thing with mindfulness. When you can learn how to tap into your own brain waves, mm-hmm. you can decrease pain, you can decrease, reactivity. And that helps people sleep better. Yeah. It helps people not be as irritable as they go through menopause.
Yes, and a lot of our listeners have irritability. I have it myself, I'm not perfect. And so you teach meditation. Do you have like an online course, or do you just do it in your local community? Or because I'm thinking maybe many of our listeners would be very interested to learn how to do that. Do you have an online course?
Absolutely. Yes, I have an online course. You can visit attunementmeditation.com. And what I've done is I've put together over the years, with working with people all over the world with many different issues and conditions, it's a 5-step mindfulness meditation process that helps you lower the stress response. It decreases pain, anxiety, depression. It's the hot flash eraser. So it's a 5-step meditation. And if you go to the attunementmeditation.com, you can sign up and just get a free download. You can get free access to the first lesson in my online course and download the audio that you can just do on your own. Whether you want to do a breathing meditation, a guided meditation, it's a very gentle way for you to kind of try this practice. And, I have a lot of success with that.
Wonderful. And that brings me on to, you're going to be holding soon the Erotic Love Summit, which I'm going to be on, haven't I? Whoa.
Yes, you are one of our featured speakers. That's right. Well, writing a book about sex and teaching around the world, of course, I put everything together in a book. But when writing the orgasm prescription, I interviewed, over 1,000 women, sometimes their partners, and a lot of doctors and experts. And I really wanted to bring that brilliance to the world. So I'm hosting the Erotic Love Summit 2016. So if you go to eroticlovesummit.com, you'll see that we have over 30 experts in sex, love, and relationships that are providing their own insight and inspiration on how we can navigate relationships and our personal health, our mental health, and even our spiritual health. How can we transform sex into a sacred experience? And because, we're dealing with menopause, you are one of our featured experts who will come and talk about, how you navigate that. Yeah. But we have speakers from all over the world we actually have someone who came on and did a tapping algorithm. So you'll see her, Bitte Visa from Norway. And it's just a fun and free experience where you can listen to these experts, get the tips that will help you have just an amazing, intimate, and sexy, erotic life. And many of them have offered free gifts. So free downloads and free products. And so it's worth it. It's worth it to sign up.
And just to let our listeners know, it's not an X-rated show. It's very down to earth, isn't it?
It's not X-rated, but I will say, I'm interviewing, well, I don't want to give everything away, but one of the interviews with this very interesting woman named Feminista Jones, she allowed me to read a small excerpt. It's not X-rated, but I read a small excerpt of her book called Push the Button, which is a story about BDSM taken from a very different angle than what 50 Shades was. So there is some erotica, but it's nothing pornographic.
Thanks for listening to Menopause Morph, your time to change. If you've enjoyed the program, be sure to subscribe to the next one and please leave a rating and review on iTunes to help us spread the message about thriving through the menopause. To get a free ebook, more menopausal resources, and to connect with Pauline, please visit www.menopausemorph.com.